Whenever we offer patients options during their IVF treatment, they often get confused. So for example, for older women, when they can't get pregnant with their own eggs because they've run out of eggs, one option is using donor eggs, which is someone else's eggs, their husband's sperms, and they carry the baby, or donor embryos, which is someone else's eggs and someone else's sperms, which they carry in the uterus and then give birth to the baby. Embryo adoption is actually a form of in utero adoption, which means you're adopting a baby. This baby doesn't have either your DNA or your husband's DNA. It's coming from another couple's. But you're the one who's pregnant. You're the one who's going to carry the pregnancy. You're the one who's going to give birth to the baby. And it's going to be your name on the birth certificate. So that even though it's an adoption, it's something which only you and your husband knows. No one else in the world does. Which actually has lots of advantages because you don't necessarily need to share exactly what you've done in order to get pregnant with the rest of the world. Now, the good news is that you have an option. You can choose between donor egg and donor embryo. Both of these have pros and cons, and there's no one right answer. So for example, donor embryo is usually less expensive than donor egg because these embryos have already been generated, and then it's just a question of transferring them into your uterus. Where do they come from? We don't manufacture them. These are spare supernumerary embryos which other infertile couples who've done IVF treatment for themselves, generated for themselves, and froze and store. But because they got pregnant in their own IVF cycle, they're happy to donate these embryos to another infertile couple. And this is a very good way of creating a family. And the success rates with both donor egg and donor embryo IVF are equally good. But when patients have choices, it shouldn't be the doctor who tells them which choice they should adopt. It should be the patient who decides for themselves. You need to own that decision for yourself. It's very tempting to dump everything on the doctor's plate. Yes, doctor, you're the expert, I'm paying you the fees, you tell me what to do, you tell me what's right. Very easy for the doctor to tell you what to do. But the doctor is not a mind reader. The doctor doesn't know what's going on in your head or what's going on in your heart. You're the one who needs to lead your life. And if you make a well-informed decision, you're going to be at peace with yourself. You love your child, and that'll make you happy and your kid happy. But if you make a decision you're not happy with because someone else told you to make that decision, and that someone else could be a doctor or your husband or your mother-in-law, whoever, you're not going to be happy. And if you're miserable, you'll keep your kid miserable and everyone else miserable. And that's why it's so important that you need to invest a certain degree of time and energy in informing yourself so you make well-informed decisions. Remember, there is no right answer. What is possible is for you to follow the right process to come to the answer which is right for you. Because 10 different couples will come up with 10 different solutions. Each one needs to find the solution which works well for them. The good news is only you can decide. And it's just a question of finding a doctor who's respectful, who understands that you're the one in control, you're the one who makes the decisions, who will offer you these options and then listen to you non-judgmentally, who will counsel you, but will not tell you what to do and what not to do. Good doctors will make sure that you don't make the wrong decision, but they will also offer you a choice of right decisions so that you can choose what works best for you. And if you then find a doctor who trusts you, who respects your intelligence, whom you trust, whom you respect his professional competence, this doctor-patient partnership can be invaluable.